guys, me again, Gareth Williams, Specialist Orthodontist. I thought I'd talk to you today about the differences in between NHS and private treatment for children under the age of 18. So every child in the UK is entitled to a free NHS orthodontic consultation. At these consultations, what we do is we count the teeth, we measure the relationship of the teeth and the jaws, and we fill in a criteria outcome called IOTN, which stands for the Index of Orthodontic Treatment Need. Now, this is an index that's been designed by the government in conjunction with orthodontic departments around the country, which tries to classify patients into their designated need as to whether they get funding or not. Some of the criteria include the amount that the top teeth stick out relative to the bottom teeth, the relationship of the bite, the crookedness of individual teeth, whether the bite alters the way that you speak or eat, whether your bite is what we call traumatic, so causing damage to soft tissues, whether you've got teeth that haven't come through, they're either stuck in the gum, stuck in the roof of the mouth, stuck down in your jaw. It's quite a confusing system because there are a lot of people who qualify for orthodontics under the NHS, clearly to an orthodontist that you might look at and think, well, how on earth have they got a brace under the NHS? A lot of the things you'd never know about because they are health risks and they're often further back in the mouth. So it's not exclusively based on how bad the teeth look. Part of it is that consideration, but most of it is the health of the bite, if that makes sense. If you do qualify under the NHS, you get told, private is still an option that you have open to you, and it's something that you might want to consider if you are unwilling to accept the parameters of NHS treatment. Now, the NHS treatment is free at the point of delivery, which is great. The downsides of NHS are that you have to put up with a waiting list, and the waiting list is variable, and it depends how much the demand is relative to the supply in that given year. Whether you're bothered by the look of metal braces, so metal braces are what you tend to get in the NHS. More cosmetic treatments, such as Invisalign clear braces or braces that go on the inside, are available privately but not under the NHS. I've put some links in the description below so you can research it for yourself and decide whether this is the right option for you. Bye now.